Are you a decision maker or IT professional facing big challenges to growth in healthcare, manufacturing, and the public sector? We are sharing exactly where technology steps in to provide solutions. Featuring discussions with industry leaders, clients, and tech experts, we're proving that with the right resources, technology can improve lives. Welcome to MST Solutions Integration Station.
Good afternoon and welcome to our second episode of MST's Integration Station. We're taking another deep dive into healthcare industry, one of our major verticals. Joining me today is our VP of Healthcare Practice, Venkat Elapully, and we're going to be focusing just for a short while on interoperability, basically creating a 360-degree view of a patient for better care. But I want to start with just maybe a kind of a look into what interoperability really means. It seems like such a big buzzword. What are the different aspects around what people think of, Venkat, when they say interoperability in healthcare?
So interoperability basically defines the standards and APIs where the patient data can be accessed across multiple EMRs, right? So at the end of the day, as a patient, I need to have access to my own data. And then if I am going to change my insurance carrier, I should be able to take my data, whatever I have, my health history, and then go to the new insurance company and say, this is what my data is, my health history is, rather than redoing every test and everything that has been done by the previous insurance company, thereby reducing the cost. So if the insurance carriers can freely exchange data amongst them regarding the patient, then that will transform to better patient care and at the same time reducing the costs because the data for the particular patient is already available. Got
it. So I feel like there's actually a few drivers there. So it leads me to my next question, because I hear in your answer, I hear patient empowerment, but I also hear streamlined costs, information where it's needed, when it's needed across systems. So can you tell me a little bit about what are those driving factors behind why so many health organizations are pushing towards interoperability technology into their systems?
So this is coming from the CMS mandate, and then CMS is mandating that patient should have access to his own information, right? It is not the insurance company is pushing for that. So now that CMS is mandating, so every insurance carrier needs to develop or make sure this particular patient information is available in a format called FHIR standards. It's the HL7 standards, which basically FHIR stands for Fast Healthcare Interoperability Resources. And then CMS has provided some implementation guides and the standards how this needs to be implemented. So basically, these are the APIs that needs to be implemented by each and every insurance carrier so that the patients can have access to their own healthcare data. Right. So that's the major push coming from the CMS.
Right. And to bring it into technology, one of the easy ways that we've been formulating solutions around this problem is with some of Salesforce Velocity's out of the box features, which I think is helping to streamline implementation of that technology. And one of the things our team found was that there was a lot of disparity between standards for the different EHRs that organizations are using. Does technology have a good answer for that? Didn't seem to up to now. What do you think now?
Yeah, so now that we have standards defined, like FHIR standards defined by CMS, so every health payer will be able to expose the patient data in the form of a FHIR API which we can access and then load it into any EMR system that the new hospital has, right? So basically, it is a standard that talks to different claim systems or health systems and different EMR systems where you can access the patient data from a different EMR into this EMR. We can load it and then we can have a single view of the patient.
Right.
That's what we got as patient.
So even if if one organization has standardized to HL7 Fire and another hasn't, through the technology that we've been developing using Salesforce Velocity, that doesn't actually matter, does it? The system is able to take these information from different EHRs, reformat it to the standard that's needed, and then plop it where it needs to go. So it seems like there's a lot of exciting applications around that.
Right. Yeah, exactly.
Pretty cool. I think that it's probably a pretty good stopping point here. And hopefully we can get you to join us on a different episode to break down some more of these different pain points and challenges around healthcare and the drive to use technology to really improve lives, not just on the patient side, but also the payer provider side. So thank you, Venkat, very much.
All right. Thanks, Jennifer.
All right. And as always, if you have any questions at all to the viewers and the listeners, just send those over, either use the comment box or the comment section below, and we will get back to you with an answer. Thank you.
Thanks for joining us today. For more on digital transformation, system integration, and how to use technology to drastically improve operational efficiency, visit us at mstsolutions.com.